Today we're going to look at some common musculoskeletal injuries within the game of hockey. Up first, we have common shoulder injuries. So what we're going to focus on today is known as the separated shoulder. Its more anatomical name is an AC joint separation. So direct impact to the shoulder causes the acromion bone, as you can see here in this photo, to move inferiorly, which causes a tear or stretch in both or one of the AC the AC ligament or the CC ligament. Some common mechanisms of injury include body checking between players, one player checking another into the glass or board, so slamming their shoulder up against a hard surface, or as you can see in the bottom photo, falling on the shoulder as a result of misstep or hooking from another player. The anatomy of the shoulder is pretty important to understanding how this is really working. So the shoulder is made up of three bones, but we really want to focus on is the acromion clavicle, acromion and the clavicle. The AC joint is where the acromion and the clavicle meet, and ligaments hold these two bones together. So an injury of this degree would be that ligament right there being torn, stretched, or impacted. How would this injury be assessed? Well, we'd start off by assessing the range of motion from the injured patient. So this would be moving the arm up and down, side to see how limited that is to help determine the severity. So this kind of injury classifies in three ways. A type 1 being a stretch of that ligament, a type 2 being a partial tear, and type 3 being a complete tear of that ligament. So those are how the degree or severity of the injury is decided. Up next, we have a common knee injury. So what we're going to be looking at here is the medial collateral ligament injury, or the MCL. This is the most common knee injury in hockey. It's usually caused by collisions that produce twisting valgus force on the knee joint, which causes the ligaments to stretch, either tear all the way, partially, or completely tear. Some common mechanisms of injury include on-ice collisions with other players, or even a collision with a puck, as you can see in this photo down on the far end of the slide. The hockey puck is directly impacting the knee joint. And just a side note, the hockey puck in this photo is striking on the lateral side of the knee, whereas the MCL injury is on the medial side of the knee. So immediately after this injury has taken place, players usually hear or feel popping, sometimes even tearing sounds. So let's look at the anatomy of the knee. There are four main ligaments in the knee that are used for stability. The MCL is made of collagen and elastin fibers. These fibers and collagen help control excessive motion, and that causes a limit to be put on the joint mobility, which is a good thing. The MCL is located on the medial side of the knee and contains three layers: the superficial, intermediate, and deep layers. Assessment of this injury would start off with a suspicion of having injury. Examination would be needed right away. Usually when assessing this, patient would have both legs exposed, so one can be observed as the control, whereas the other one can be observed for any swelling or redness. Similar to the previous injury, the severity of this injury is on a graded scale. So grade 1 is a 0 to 5 millimeter opening, meaning that it's just a stretch. Grade 2 would be 5 to 10 millimeter opening in the ligament, meaning it's a partial tear. And grade 3 would be complete opening with 10 or more millimeters, meaning it's a complete tear. Sometimes when assessing this, the PT or AT or whoever's assessing will apply gentle valgus force to see if there's any indication of pain, and usually the knee is in 30-degree flexion. So again, some key things to look for in the assessment would be, is it swollen? Is it tender? But overall, MRI is really the best way to visualize what's happening internally with this injury. Up next, we have hip injuries. So even though it may seem simple, the most common hockey injury to the hip is a hip pointer. Now, this is just another way of saying a severe bruise or even a hematoma to the hip. It's not always seen. Sometimes they are deep in the muscle, but as you can see in this photo, sometimes they are apparent, very painful. They are caused by direct blow to the hip or fall on a hard surface. And the main concern is to really minimize the hematoma. Rest is really important for this injury to heal. So some common mechanisms of injury would be, again, players being checked into the wall or even checked down falling on the ice. Really any contact with hard surface, causing them to be unable to rotate their trunk or flex their thigh without pain. Again, falling on a hard surface is really the cause of this, and that can happen in a couple different ways. So let's talk a little bit about the anatomy. So the pelvic brim or iliac crest is a superficial and bony prominence on the hip. So again, we'll even see sometimes the top of the femur can be a nice place because it kind of protrudes a little bit. So these are all parts of the pelvic girdle, and many muscles attached here, including the internal and external obliques, the rensor fasciae lata, the gluteus medius, and the paraspinal muscles. An injury like this can also cause possible pressing on the femoral or lateral femoral nerve, which can indicate pain or uncomfortable sensations. Usually to assess the situation, obviously, if it is visual, it's a good indication right away, but sometimes radiographs are used to ensure that there are no fractures because that can be, a whole new set of problems. MRIs or ultrasound can also be used if to determine the extent of the contusion or hematoma present, and it is really popular, or it is really recommended with younger athletes to go ahead and do that radiograph and the MRI just to ensure that as they're growing, nothing is being, and if there is a possible fracture, that nothing is going to be growing out of whack. So again, to summarize, hockey is a high-speed, full-contact sport that results in a lot of common injuries, including but not limited to AC joint separation, medial collateral ligament injury, and hip pointers.